Um, with January 1st, 2014 coming about, the magic question is, what are going to be the rates, and how do I purchase insurance if I'm an individual? Well, this new thing is starting up in the law. They called it the Federal Exchange, and this was supposed to be a marketplace where every carrier has similar products and similar descriptions to their plans so that they can view all the plans in one place. What this marketplace will look like, essentially an online portal where people will buy bronze, gold, silver, and platinum plans. They're generally categories based around the types of benefits that they are. As we see this upward pressure on premiums, there's also going to be federal subsidies to purchase insurance. So no more pre-existing condition limitations, no more declines, no more rate ups. One of the biggest impacts to rates is that they can no longer charge a difference between a male and a female. And that all those things have dramatic upward pressure on the premiums for individual policies over today's current rate. So we'll talk a little bit more specifically about what we expect those rates to be like. But in today's world, a 30-year-old male, for example, that's in good health can buy a $2,000 deductible plan for about $80. In tomorrow's world, that same person will be able to buy that $2,000 deductible plan for roughly $260. So the 250% increase for young males. A 64-year-old male that has been rated up because of health conditions will actually see his rates fall in 2014. We won't actually know what the specific rates are going to be for all the different plan options until October 1st. As these premiums go up, there's also federal subsidies that come into play. Very complicated calculation. We recommend that every single person that is going to buy through the exchange work with a CPA to know exactly how to figure out their projected modified adjusted gross income for 2014, because that's what they're going to take subsidies based on. But say one person in that household works and they make $50,000 a year, their modified adjusted gross. What the calculator is going to spit out here is their percent of the federal poverty level. This one shows 212% of federal poverty. And then down here it says what the government subsidy is the most they can pay for health insurance as a family monthly if they buy the second lowest cost silver plan in the exchange, which we don't know what that is yet, but we can project that it's going to be roughly a $2,000 deductible PPO plan. The most they pay for their entire family of four, is $317 a month. Here's what you need to know as an employer. If one person in an individual's household is eligible for affordable and qualified group health insurance coverage, they are no longer subsidy eligible at all. No one in their household. So as how we define affordable is important, and you want to be aware of this, is that if the employee pays less than 9.5% of their Box 1 income on their W-2, then they have affordable coverage. Qualified, we won't dive into the details of that. It's full of weeds. 60% actuarial value is how we define qualified. What I can tell you is that everyone sitting in this room has a qualified health insurance plan. We find very few that are not rich enough in benefit. We'd have to be over a $5,000 deductible to not pay at least 60% of healthcare expenses in general.